Probability plays a fundamental role in medicine, providing a framework for understanding uncertainty and making informed decisions in patient care. At its core, probability is the measure of how likely an event is to occur, expressed as a number between 0, impossible, and 1, certain. In healthcare, basic probability principles help clinicians interpret diagnostic tests, assess risks, and choose appropriate treatments. For example, when evaluating a diagnostic test, two key probabilities are sensitivity, the likelihood that the test correctly identifies those with the disease, and specificity, the likelihood that the test correctly identifies those without the disease. These values help determine the test's reliability. Another important concept is prevalence, the proportion of a population that has a particular disease at a given time. Prevalence affects the predictive value of diagnostic tests. The positive predictive value, PPV, is the probability that a person with a positive test result actually has the disease, while the negative predictive value, NPV, is the probability that a person with a negative result truly does not have the disease. Both PPV and NPV depend on the prevalence of the disease in the population being tested. Probabilities also guide clinical decision-making through risk assessment. For example, estimating the probability that a patient will develop a certain complication allows providers to weigh the benefits and risks of preventive interventions or treatments. In epidemiology, probability underpins the calculation of measures such as relative risk and odds ratios, which compare the likelihood of events between different groups. Ultimately, understanding and applying probability concepts enables healthcare professionals to interpret data accurately, communicate risks effectively, and make evidence-based decisions that improve patient outcomes.